Hi, my name is Dr. Ami Dakshini. I'm a dermatologist practicing in my clinic called Think Skin Clinic in Bangalore. So let's understand the process of aging before we try and understand why do we get wrinkles. So aging is a complex, interrelated 3D process which affects multiple organs starting from the bone, the muscle, the fat as well as the skin. Now what happens to the bone? Let's begin with the bones. Bones because of aging start getting resorbed or they start getting absorbed into the system. For example, if our eye sockets are here, the sockets start enlarging because the bone gets resorbed. That causes the eye to sunk in. The eyes look smaller, and that's when you start developing the under eye lines and wrinkles. Also, if you look at the chin starts resorbing or going backwards and becomes shorter. So the skin starts hanging, and that's when you notice sagging of skins and lines over here. Then, after the bone comes the muscle. Now, repeated activity of the muscles over the years changes the muscle's tone. That's when you start developing dynamic wrinkles. Dynamic wrinkles are wrinkles when you express on your face. Dynamic wrinkles develop when you actually start using these muscles. So, when you start frowning, is when you see the frown muscles. When you smile, you start getting the crow's feet. This is because of the muscle activity over the years. And with aging, the skin over the muscle also changes. Then the skin starts dipping into the fold, causing a static wrinkle or a static line. Further comes the fat. Now, fat also starts getting resorbed and fat starts moving downwards because of gravity. So, you notice sagging, you notice jowls, and many a times there is hollowness over here because the fat volume starts reducing. And last is our skin. Especially in the second layer of the skin, which is called the dermis, it contains three very important ingredients: collagen, elastin, and hyaluronic acid. All these three form a structure, give support as well as bounce to our skin. Now, once they start getting deteriorated because of age, because of sun exposure, collagen elastin production reduces. That's when the skin becomes thinner and starts sagging. That's when you notice more lines and wrinkles developing on your face. So, this is how a wrinkle is generated into our skin, aging right from the bone to the skin. Now, how do we treat these wrinkles? There are multiple ways that we can do, right from applications to surgical procedures. But somewhere in between come the injectables, which are now getting very popular. There are two ways we inject. One, the injectables that target the muscle. So, when the muscle movement is more, you notice that the skin dips in the area where the muscle moves. So, we stop the movement of the muscle. That's where we use something called the botulinum toxin. This is derived from a bacterium, it is a protein. So, when this is injected into the muscle, the activity of the muscle starts reducing. So, even when you express, the muscle doesn't move, the skin on top doesn't change. That is how you can prevent as well as reduce the wrinkle appearance. The second form of injection is where you fill in the fat or the collagen which has depleted due to age. We fill that up like we fill cotton in a pillow. So when you fill that up, the skin gets lifted as well as the volume comes back to the face. Now these are called dermal fillers. There can be multiple variety of these dermal fillers. The commonest that we all use in India is either hyaluronic acid or fat injections. There are others that are available too, which promote collagen production. Now, when we inject a filler, we inject it places where we need it. So, deeper fillers are injected onto the bone. Superficial fillers are injected in and around the skin. These lift up the skin and prevent the lines and wrinkles. The treatment costs something between, like the botulinum toxin can start from say about 5,000 to almost 50,000 depending on the number of muscles that we are targeting. And the dermal fillers, generally, if it is a good brand, starts with almost 15,000. And depending on the number of injections that you do, it can go all the way up to a lakh. But remember, all these treatments are temporary. Botulinum toxin lasts for about 6 months, and the fillers generally last for a year to a year and a half. So you need to repeat these procedures accordingly and your skin does not get affected, and there are no other side effects if injected by the right person. So I recommend that if at all you're considering any of these injectables, go to a well-trained expert, either a plastic surgeon or a dermatologist, to undergo these treatments.